Good morning. Welcome to the IEEE Humanitarian Technology webinar series. Today's presentation is given by Marc van den Homberg. It's entitled Leveraging Information and Communication Technology Business Models to Help Reduce Poverty. The Humanitarian Technology webinar series is free and publicly available at humanitarian.ieee-elearning.org. The entire team that's bringing you the Humanitarian Technology series is supported by the IEEE Humanitarian Ad Hoc Committee and is chaired by Amrit Raja. The Humanitarian Technology webinar series will ask you right now to enter your name and location in the Q&A window to the left-hand side at the bottom. During the webinar, please enter any questions that you have in the Q&A window. The presenter will answer a selection of questions at the end of the presentation. Afterwards, to receive a professional development hour credit, please go to humanitarian.ieee-elearning.org. Also, we invite you to become an IEEE member. You can continue to share knowledge, join a community, and connect with other professionals in your field. A little bit about Mr. Marc van den Homberg. He is the co-founder and leader of the Information and Communication Technology for Development team at TNO. TNO is an independent research organization whose mission is to connect people and knowledge to create innovations that boost the sustainable competitive strength of industry and well-being of society. Marc holds an MBA degree from Rotterdam School of Management and a PhD in physics from Delft University of Technology. I present to you Mr. Marc van Homberg, and his presentation, Leveraging ICT Business Models to Help Reduce Poverty.
Thanks, Ashmore, for your kind introduction, and welcome to all the people attending from all over the world, I guess. It's my pleasure to present to you this webinar about this fascinating and very inspiring topic. I will first explain to you the methodology that we used within this project to classify solutions in order in the end to learn from what works. What we did, we made an overview of about 280 projects existing in the area of mobile services for the base of the pyramid, and we narrowed them down in two steps to 140, and in the end to 15 projects at which we looked in a lot of detail. Here it's shown in some more detail with some more explanation. As you can see, we did an initial scan using, for example, reports from the UN, from Ashoka, but also from mobithinking.com or mobileactive.org. And then we eliminated those projects that were based on a grant, fully based on a grant, which were like pre-pilots or which were already dead or post-pilots. And in that way we ended up with 140 projects. And then we started to map them on the needs of the clients, the users. We also used that mapping then to cluster, and we involved about 40 experts, 20 from outside the partners in this project and 20 from within the partners. And we then made a selection based on the best practices, larger scale, and based on the innovative solutions that were used and the potential to scale. So that way we ended up with 15 case studies, and we did 5 field visits to analyze the business models that were really representative. In this way, we ended up with the 15 cases in 4 clusters. The clusters were education, health, agriculture and support to economic activities, and financial services that you can see in this row. And in this column, we plotted the 3 different business models that we distinguished. So one was a direct access model, a model with a local agents, and in the end, a crowdsourcing or crowdfunding type of business model. And I will explain those models later on. The projects we analyzed span 3 continents. Here you can see the spread. And then about the 3 business models we used the direct access model, a model where you have your local agents, and a crowdsourcing model. Now we'll explain the 3 of them in more detail. The direct access model, then you have information which is accessible directly on a rather cheap ICT device, for example a low-tech mobile phone. And yeah, that's demonstrated here by the light blue square. And you need, of course, a technology backend as a source of the information and for the service. In the case of a direct access model, you need really to reach some scale, because the technology backend becomes then more economically viable. The next model is where you use a local agent, and you can deliver specialized services by trusted intermediaries. So here again, in the dark blue, you see the technology backend, and in the light blue, the technology front end at the local agent's premises. And on the right hand here, you see the end users that benefit from the service. Important is that the local agents are skilled enough to use the technology, and that they are trusted in their community. And here also you need to make an initial investment to start. So also the local agent in some cases has to invest in order to start. And the third model, the crowdsourcing model or the crowdfunding model, there you have really two-way services. So I'll first explain the top line here, where you have, for example, the organization that is gathering the data. That can be TextEagle or the CKW, which is the community knowledge worker. They gather the information, for example, for an organization like the World Bank or the UN, but can also be a large multinational, through a technology backend that sends out questionnaires to the crowdsourcers. And these people, they get paid by filling in those questionnaires, for example, by airtime credits. And you see here that this is a two-way interaction between the people who do the crowdsourcing and the technology backend. And towards the client organization, there's just a one-way service. In the case of crowdfunding, you have a two-way interaction between the party here on the left side. For example, this can be someone who wants to improve his business, and he needs some budget for that or funding, so he can request that through the technology backend, and then it is crowdfunded by the people here on the right-hand side. And there's a lot of interaction, because in the end also the people who donate the funds, or we give the funds, they sometimes they get a benefit in terms of interest rate. So that's clearly a two-way service. So those were the three business models that we looked at. And now I want to see how the rhetoric that surrounds ICT4D projects matches the reality. ICT has long been talked about as a lever that would enable developing countries to take shortcuts to development, and hence to avoid decades of trial and error that more developed countries have gone through. And indeed, ICT can deliver information and expertise to people who do not have either physical or financial access to these resources, and it can help remote base of the pyramid consumers to make improvements in their life. So there seems to be a right momentum, especially if you look at this graph, because the connectivity has increased enormously. You can see here that up to 68% of the population has now access to mobile phones, and about 21% to internet. So that should no longer be an obstacle. So one could say that the rise of mobile phone and internet usage makes it possible today to reach the base of the pyramid via market-based approaches. However, ICT is no silver bullet, and that is actually, let's say, proven by the study, because most projects using ICT for development are yet to find sustainable business models. What you see here on the left side is a clustering of the projects in the sectors. So, for example, in the health sector, you can see that only 20 out of the 103 projects used really a market-based mechanism. Financial services, the situation was better. It was like 48 out of 57. And agriculture was also not that bad. Education, however, there were not that many examples. And we will see later on that education and health are the sectors where it's more difficult to have a really market-based mechanism. This middle row or a column shows the division over the continents. And well, you can see that we look mostly at projects in Africa, the Middle East, and in Asia. If you look at the business models, you can see that the direct access model has about 52 out of the 100, let's say 16 projects which are really market-based. In a local agent, that's less the case. There are a lower percentage of projects which is market-based. Financial services we stated here as a separate category. It's usually a mix of direct access with local agents. And again, you see here that majority of them is or can be market-based. Crowdsourcing is really a new area, a new field, so we have not that much statistics there yet. So in conclusion, financially sustainable models exist in finance and agro-services, and to a lesser extent in health and not yet in education. And I will now go into more detail explaining that. Let's first look at financial services. In total, we looked there at about 6 case studies, where the direct access and local agent models were Bradesco, M-Pesa, and Fino. So here you see the Bradesco case, which is branchless banking through local agents connected to the internet in Brazil. M-Pesa, maybe the most well-known example, is the offering of financial services through mobile phones in Kenya. And Fino, I will talk about in the next slide. So those 3 are examples of direct access and a local agent business model. If you look at the crowdsourcing financial services, we looked at MYC4, which is financing African entrepreneurs through the internet, such as this lady who has a chicken farm. Text Eagle kind of sells, let's say, mobile surveys in exchange for airtime credits. And that's shown here. You see in this picture a questionnaire that is filled in by a local agent. And here you see the payment that is done to the local agent in the end, because he filled in the questionnaire. He gets airtime credits. So that's the second example of crowdsourcing. The third example, here you see the logo of the Grameen Foundation, is a community knowledge worker, which is used to improve information flows and knowledge dissemination for the last mile smallholder farms in Uganda, who mostly live off the grid. And that community knowledge worker and that service has actually also been extended into using mobile money. So as I said, I would look into one of the cases in more detail. Well, this is the Fino case, which is mostly a local agent model. It is an integrated payment solution company that started out of the ICICI Bank in India at the time that they were investigating how they could support microfinance institutes more than they did before. It's actually the largest project that we've seen. It has up to 28 million users at the BOP since they started in 2006. Those are, let's say, the end users, but in the end, clients of Fino are also the 23 banks, the 10 microfinance institutes, and 15 government entities, and 5 insurance agencies that they serve. Because if you look at their services, what they do is, for example, for government entities, make sure that people at the BOP get their pension payouts. And also they provide the possibility to save, access to loans or credit that people can do remittances, and they sell also insurances. The distribution is done via 15,000 field agents, which are called customer service points, and they use a kind of a handheld point of transaction terminal with biometric smart cards. And as you can see in this picture, in that way you can really go to rural areas without having the need for other type of technology. How are they doing financially, Fino? Well, the profit margin was up to 15%. The revenue was $52 million in 2011. And, well, the cost for the users were that they could freely deposit, but in some cases they had to pay up to $0.50 per transaction. And the loans, well, they are up to 24% interest rates. If you now zoom out again and look in general at the financial cases, then this diagram shows us different services that you can offer. So money transfers, remittances, payments, savings, loans, and insurances. And in italic, it's indicated actually what that means for the base of the pyramid. What is the impact? I will go through all the cases stated here, but let me just pick 2 of them. The secured money platform. Well, what it means for the BOP is that they can now avoid a safety risk from carrying cash or having cash at home. And actually, I must say that sometimes now the safety risk is transferred to the local agent. There are quite some cases of robbery of the local agents because they do have to carry cash with them. Another advantage of the secured money platforms is that there are lower costs for the user because they don't have to go to, let's say, a traditional institution, which might be at a quite long distance, requiring travel costs and also loss of working time. Second example out of this slide is the use of insurance. The access to insurance gets now easier, and also the enlarged customer base allows the companies to offer a lower premium. What was very clear here is that, especially with a service like insurance, understanding of the service is very important, and there a local agent can really help if it's someone who's trusted in the community and who takes the time to explain how it works and why you sometimes have to put money aside for 15 years before you see something in return. Then it might work to sell insurances. But this is usually initially quite a hurdle to get there, and it requires quite some effort. So what we see is that simple ICT banking replaces the more expensive practices, and that the complex ones, like insurances, they need consumer education to elicit payment. Then I move to the next sector, which is agriculture. And there we looked at 5 cases, 2 direct access ones. And one of them is Isoko. Isoko improves small African farmers' bargaining power by bringing them relevant market data on their mobile phone. And they have franchises in Ghana, Nigeria, and Mozambique. Reuters Market Lite is another example of a direct access business model, and I will talk about them in the next slide in more detail. Then the ones which use local agents that are EQtier, Drishti, Ichupal, and also the Community Foundation with their community knowledge worker. The community knowledge worker helps to improve information flow and to disseminate knowledge to the small holder farms in mostly Uganda. Drishti uses ICT to provide web-based services and to distribute fast-moving consumer goods in rural India. And they use village kiosks and what they call Drishti rural retail points. And actually, they located those kiosks and those retail points looking at the previously used route for milkmen, so that the milkmen routes. And along those routes, they established those new shops. Then Isupal, that's shown here on top. They improve agro-sourcing and they bring services to small farmers in India through farmer-run internet kiosks, or, and that's shown in this picture, rural retail points where they also sell fast-moving consumer goods. And the last one is economical. They improve small farmers' lives through franchised agro-village kiosk in India. And they have actually close relationships to farmer interest groups, collectives of farmers, which makes it for them easier to get access to a whole group of customers at once. So we then zoom in into one of those case studies, Reuters Market Lite. In this picture you see actually what they offer. So on the top one you see you can get information about market prices, weather forecasts, agri-info and crop advisory, and international and national news. And here you see an undergrad student, well at least at the time of study, in IT, who is, apart from his study, a markets reporter for Reuters Market Lite. And you see him here at a Mandi, a local market. And well, his tools are his cell phone, of course, where he can send the crop prices, and he has a RML market reporter card. So some of the business aspects of the Reuters Market Lite. Well, the service I explained already. Maybe good to know that it can go up to 4 or 5 times a day. So the timeliness of the information is very important. They have about 100k subscribers in 15,000 villages, and they use as a distributor trade partners such as the mobile service providers, the Indian Post Office, the Co-op Credit Society, agri-product companies, and that adds up to about 1,500 distributors and 20,000 retailers. What does it cost? Well, it's a free subscription model, but you pay then about $7 per quarter. And revenue in 2009 was about 1 million. And actually, maybe good to know, RML really started out of a, let's say, multinational, out of Thomson Reuters in 2006, when they were working on an innovation program, and this was one of the innovative ideas, and they really innovated the business model. Then again, a diagram that shows the different services that you can offer to the BUP in the agricultural sector, and what it means to the BUP. So here you see information on the decision on when to plant your crop, sourcing of inputs, cultivation, sales of outputs, and the monitoring of the farmer's data. Again, I will not go through all of those examples here of what it means, but pick two. One is, for example, the monitoring of the farmer's income. That actually leads to a credit history, and that allows farmers then to access loans. And here you see actually a very important point, that the fact that you have such a credit history allows you to offer a different service. And the more services you can offer around your, let's say, existing distribution network, the easier it gets to make your service profitable. So you see a lot of agriculture initiatives who extend also into the financial domain. The other one is the info on prices. That's shown here, sourcing of inputs. It's info on the prices if you buy material, but it's also info on prices if you want to sell it. And there farmers can see directly the benefit to their income. There are even cases reported where farmers had a kind of a 200% increase in income because they could sell their harvest at a higher price. And an anecdote in general is also that the farmers that do use this kind of information, they usually get also more respect among their peers. Then I move on to the third sector, the healthcare sector. Then we looked at in total about 3 case studies. Here you see a direct access model, that's Pedigree. That one I will single out and talk about in the next slide. Then we have the Grameen Phone and the Telemedicine Reference Center Limited. They offer medical services on the phone to Bangladesh. And it's really 24 hours, 7 days a week. And this works very well. The problem only with the call centers is that there is a high churn of and turnover of the doctors working in those call centers. So they have a challenge to tackle. Then a model with a local agent, that's the NHH hospital. They offer actually quality cardiac healthcare for the masses. And how they do it, that's very interesting. They reduce their overall cost by very high utilization rates of their infrastructure. They have 25 hospitals, and they are, let's say, fully booked. They're continuously in use for heart surgery. And they manage to do that by screening out patients who do not need physical in-person care by using telemedicine or remote diagnosis, for example, of electrocardiograms. Now I zoom in on one of them, the Pedigree case. They have about 2 million customers and 6 million products that are protected in 3 countries. But maybe I should explain a little bit more of what they do. That's shown here with these 2 photos. What you can do if you go to a pharmacy, you can scan a code, the code that is attached to the packaging, and then you get an SMS with a verification of the codes is genuine or not. So here you see, okay, quality assured, genuine product. And that's because there are a lot of medicines out there which are not, let's say the right ones, which are fake. The service is for free for the users. However, you still see that not that many people use the service. So there is still a, let's say, a marketing issue, because it was seen that in the pilot phase that only 10 to 20% of the packs with medicines generated a verification SMS. About the financials, we do not have that many detailed figures. We can only say that the revenue is the sales of the codes to the pharmacies, minus the cost it is to offer those SMSs for free, the printing of the labels on the packaging, and the overhead, of course. So the profit margin we do not know for this service. What's in it for the consumers? I explained already. They can verify the authenticity of the medicines. And the pharmaceutical or the distribution companies, they increase the consumer trust in their brand, and they can counterfeit tracking. Distribution is done by direct access for the consumers in the pharmacies, and they partner with companies like HP for the printing and with mobile operators. And then Pedigree is active actually in Ghana, Kenya, and Nigeria. Then again, the diagram showing the services and the impact on the base of the pyramid. So you have the awareness, the decision to seek care, the desire for primary or preventive care, the local delivery of basic care, the advanced specialized care, the follow-up care, and the long-term the tracking of once you have received healthcare. And then you have the monitoring of the patient cases, the regional health, data, drug, authenticity, etc. And what you can see actually here is that not that many of the impact issues on the BOP are bold. And that means that those cases, shown here, light gray, they are not market-based, or they are very hard to get market-based. For example, awareness on disease. It seems to be very, very hard to have awareness campaigns or prevention campaigns that have a business model. The only way would be maybe to link it to insurance, but that has not been done so far. It is possible to have a market-based approach, for example, in the advanced care, where I talked about the hospital in India for cardiac surgery. That can work, but also there's still some funding needed from for example, the government or philanthropy. A large trend you see as well is the local delivery of basic care, where you can have, let's say, the doctor in your pocket. That, of course, brings down the cost. What you see actually at the BOP is that a lot of people can be over-impressed by the modern healthcare systems, and therefore a kind of remote delivery of healthcare can work if it's done in a familiar setting. So far about the health sector. Then I will move on to the last sector that I will discuss, which is education. There we looked at 2 case studies. So one is from the BBC, the Yanala initiative, which is a direct access initiative. And BBC Yanala is actually one of the rare projects in education where customers really pay something. We also looked at Dristi, which was already mentioned in the agriculture case, because what they did is actually that they used their kiosks to offer also ICT training and education. I zoom in now on the BBC Yanala case, where you can learn British English for the cost of a cup of Bangladesh tea. So the service they offer is actually a combination of mobile, internet, TV, and newspaper-based language lessons. So they really combine several platforms. They have 3.8 million customers in Bangladesh with 6 million paying courses, and they're actually expanding into other countries as well. The distribution is mostly direct access, and they partner with mobile operators such as Bangladesh TV, and Bangladesh TV. Financials, what does it cost? Well, it's about $2 cents for a 3-minute lesson, plus, of course, the cost of access to internet, if you use the internet instead of your mobile. We do not have really, let's say, revenue and profits figures, but they looked at their cost efficiency, and they are now up to $4 per person across all the platforms that they use. And regarding their finance, they have a commitment of the VFID, the English Ministry of Development Aid, for up to 2017. And after then, it really should be possible to become a financially sustainable service, because they have invested heavily in the platform, and this platform can be replicated in other countries now as well. So the scaling up will quickly bring in more revenues and might lead to profitability. I'll move on again to a diagram showing the services and the impact. Here you can look at services before you go to school, when you're at school, and after school. And actually, I should say that you can look, of course, at individual education, or you can look at more professional type of education, or you can look at how you can support the people providing the education. A lot of services we looked at, or what we talked about, they are more the individual cases. And in some cases, the more professional ones. Again, you see here in light gray, those services, or that impact that is not yet market-based. So, to give an example, to share class content or to offer classes via video conferences, it's very hard to make that financially sustainable. We did find 2 examples of where it is possible. So mobile phone-based courses, well, at least with BBC Janela, you can see that it will get there. And with ICT classes, if it's more related to a professional development, then those services do become financially sustainable. An interesting model actually around those ICT classes is that quite often the companies that offer those type of classes, they start with entry courses which are rather cheap, where they do not really make a profit. But once the people have done those initial courses, they will move on to more advanced classes, and there they can then charge, let's say, a normal fee. About the mobile phone-based courses, actually it's also interesting maybe to mention the one where you have quizzes on the mobile. In South Africa you have MoMath, and that seemed to be quite a success because the children really loved it. It was really made like a game. So you could, out of school, practice your math, and you could get right away feedback on your results. But also that is not yet a service that is financially sustainable. So, to repeat again maybe, financially sustainable models, they exist in finance and agro-services, to a lesser extent in health, and not yet in education. So what makes, let's say, finance and agro-services such a success? Well, entrepreneurship is key, we will find, and collaboration is key to scaling. The successes we looked at, they had an entrepreneurial debut, starting point. They really focused on the ability and the willingness to pay of the targeted clients, and they did not look at the needs assessed in a top-down manner. So they really looked at the grassroots willingness to pay. And it was built from the ground up. In the end, a systemic approach was needed, cross-actor, cross-sector, to reach scale. And there the issue was where you could see that people started maybe with just a simple service about pricing in neighboring markets, and they ended up with insurances as well for their harvest. And yeah, that's a very good way to reach scale, because it generates multiple income streams over time, and it maximizes the revenues. If you look at the challenges that were mentioned by the 15 project leaders that we interviewed for the study, we can see that a lot of those projects, they face similar issues in order to reach scale. If you look here at the policy challenges, it was really important to have support from the government and enabling policies. You can imagine sometimes that in education, people had to deal with 3 ministries: the Ministry of Education, the Ministry of Telecommunications, and the Ministry of Economic Affairs. And yeah, that can be quite time-consuming. If you look at the internal capacity, you have to recruit agents, train your internal staff and the workforce. And yeah, for example, in healthcare, we saw the examples of that you can have a high turnover, and that it might be hard to train the right people. And for example, in healthcare, they're now looking at models to see if they could go for somebody with ICT skills and some doctor skills, instead of going for a doctor and training the doctor some ICT skills. Third challenge, partnerships. How to partner with mobile network operators, how to deepen existing partnerships. That all is around that business model, the long-term commitment, that can be challenging. Funding, especially important is patient capital. To build up services like this and to reach scale takes time. So you need an investor that is willing to have that patience. And often it's hard to get investment in advertising from third parties. And it's very important to advertise, to market your product, and to get people to be aware of what you're trying to serve. Technology, robustness, usability. You see, especially with the services that really reach enormous scale, that, for example, with Textigel, it's very challenging to have an IT platform that can deal with that enormous load of, let's say, data. Finally, of course, connectivity. It's still usually now small bandwidth, so more broadband is needed, and increased mobile penetration, where you can think of actually also illiteracy issues. A lot of people really, let's say, deep down into the BOP, they might be illiterate and not that capable of using their mobile phone. The recommendations that we had was to focus this on the problem-driven approach, which actually will go automatically if you have that grassroots starting of a project. So really focus on what's needed and where are people willing to pay for. So identify first those local problems and then develop the solutions. Second point, support existing entrepreneurs and promote cross-sector synergies. And that support can be, for example, that you offer as a government a one-stop shop for an entrepreneur setting up his project or his company. Third point, create a systemic environment for cross-border replication. And with that, I mean that we should avoid reinventing the wheel. So, for example, BBC Canada is doing that very well. They are reusing their language platform also in other countries. And governments and international organizations, they can really promote this. And actually they are also doing this. For example, the World Bank, they are currently pushing for coordination of e-development initiative through their program which is called e-Transform Africa. And also the European Union, they have stimulated R&D efforts in this direction through their EU-Africa ICT cooperation. So, my final 2 slides. For those who did not look at it yet, we have a public available report which presents the project findings. It's 220 pages, but worth the read. And there's also actually an executive summary, which is shorter, of course. And I would like to end with thanking you all for your attention. And I will see now if I can address some of the questions that might have come up already via chat. Thanks a lot.
So we have a question. Someone would like to see slide number 12 again.
12. 12. This one?
Yes.
And what was the question? Can't see the question. The slide was the title, slide 12.
So they just want more details.
So I'm not sure if I understand this slide. Okay, yeah, I see. Okay, and what is exactly the question? Hello? So the question is, what are the expectations for 2011 and beyond regarding the mobile business cases? Yeah, that's a tough one. It will be a question that you have to address, I think, per sector. But more in general, I could say already that, of course, as you know, in Europe, we have penetration rates of mobile phones which are over 100%. So Africa is the fastest growing market. So for sure, the mobile penetration rates will go up and maybe reach 90% in a few years already. So that means at least the volume will go up. So that's positive for the business cases. I think agriculture and the financial services are the ones where you can see the most growth. And yeah, the volume of those markets we have actually reported in our report, I think, but I don't know them the top of my head. Okay, I see Fred writing yes. Okay, thanks. Yeah. Okay, thank you for your question. And there was an earlier question I saw. On the Reuters Market Light, please clarify how access is free, but revenues are $7 per quarter. Yeah, the access, actually what I meant there is that you can sign up for free. So you can register for free. And to have access then to the service, you pay $7 per quarter. And this is $7 for higher tire services or for all users. Yeah, I think that was more or less for the let's say, more average package of service that we looked at. But of course, if you want to, we could look up the numbers in detail and then explain them to you. Let's see. Then I see another question. In India, many people are living in rural area. How can we promote higher education through ICT? Can you give some suggestions which can be carried out by students for community service? Then it's maybe good to go to the slide. So one option is maybe that the few persons in rural India who do have access to internet or to mobiles, that they of course involve others in what they are doing. Actually, there was an interesting project in India, I think, which was called Hole in the Wall, where they put a computer in a slum and they noticed that people, even children mostly, managed to learn themselves how to use the computer. So, well, very important might be hence to have access at all to some kind of ICT service. So if there's no access, then it might be hard to teach ICT skills. And the other one that actually NGOs are looking at is if you could offer micro work to local communities. So, for example, Oxfam Novib, they are looking at if you could put kind of internet containers in northern Uganda, and that people can go to those containers to get skills, to learn how to work with computers, and at the same time they can also make some money by, for example, annotating satellite images. And they use a micro-sourcing company called Sanoma to work with. So those are maybe two suggestions I could give. See. Any more questions? Ashmore? Yeah, link to the report I could share. I don't know if I will get your email addresses, but please do contact me. If you want, through my email address, which is marc.vandenhomberg@tino.com.nl. Sorry, here you see my email address. So if you send me an email, I will send you a link to the report.
Okay, we'd like to thank you for joining the webinar series. As Marc had said, you can contact him via his email address to get a copy of the report, and we hope to see you next month with our next webinar. Thank you very much for attending.